Yeah, we are live.
So, hello everybody. I think today's topic, that is what a gynecologist or an IVF specialist should know about incubators, is a very important one. I think as clinicians, we need to be aware of our machineries and also our things in the embryology lab to give that optimal and the best possible results to our patients. So, the most important thing in this is the incubator and the media. The incubators provide the physiochemical environment that is required for the embryos, which mimic the natural conditions as it is in the human body. So, choosing and knowing about the incubators is extremely important as an IVF consultant. So, over to you, Dr. Jay. I mean, yeah, as clinicians, I think this is one of the things that we don't really look out for and try to know more about it, except I think checking out the
Cost.
costing and paying the check. Beyond this, I don't think we really put our mind into it, and we leave most of it to the embryologist if we have a full-time one, or we depend on the traveling embryologist if we are doing batch IVF. So it makes a lot of sense, I think, when Dr. Jay suggested that we do this topic today, because it gives us a lot more involvement, and also it gives us also as an insight when we are talking about the results in the audit. So over to you, sir.
Basically, people must understand that incubators are required at any place where you want any sort of an organism to grow on a culture system, right? Basically, you require it in microbiology, you require it in pathology, you require it in IVF, because even in microbiology, you are doing cultures. So, for the culture to happen over a culture plate, which is basically just like how we prepare our culture plate, right? You need the organism to grow. That is why you need incubation. Uh, Coming straight to the point, in IVF, there are three types of incubators which we commonly use. One incubator is the box type incubator, the standard Thermo Fisher Cell, whatever people must be using. Some people must be using ESCO. The second is the benchtop incubators. Multiple systems of benchtop incubators are available: K systems, Planner, Mink Plus, whatever. Okay. Again, ESCO is there inside that. Inside that, Aztec is there. Okay. And the third is time-lapse incubators. So these are the predominant three incubators which, as a clinician, you have to keep in mind. When you set up an IVF laboratory, if you go through the setup systems, everybody will suggest a box type incubator. And the requirements for box type incubators are pretty straightforward across all locations, because a box type incubator is predominantly dependent on a single gas, that is CO2. Of course, you do have tri gas box type incubators as well, but majority of the box type, 99% of the box type incubators are going to be a single gas flow, which is the standard gas is CO2, because you need CO2 in order to ensure that the media gets buffered nicely, because the media contains a lot of pyruvate. So what typically happens is you need something to buffer the pyruvate, and CO2 is the medium which can buffer the pyruvate by producing bicarbonates inside the media. That is the simple logic of using CO2 incubators, no rocket science. Okay. So with this much said, I will just move on to the three incubators, and I'll try and wait. I'll try and share the screen. Yeah. So can you see the photos here? So see, this is the standard incubator, benchtop incubator. This system which I'm showing is a Mink incubator. You can see that it is calibrated at 37 degrees. Okay, and you can see that the CO2 is purging inside. But this is a tri gas. So it has CO2, it has oxygen, and it has nitrous. It has all the three things. This is how your plate opens. So you have four center well dishes which can be accommodated inside an incubator. Obviously, everybody is labeled or tagged or whatever you do. And you have these smaller plates also. So if you are using a 1032, which is a small 18 millimeter plate, approximately six such plates can be accommodated or 5 such plates can be accommodated on a single side. So you have 10 such patients whom you can keep. See, that is the inlet through which the gas is flowing in, as you see. Okay. See that? Can you see the bottle inside getting bubbles inside? Can you see
Yeah.
that? So
Yes.
that is the purging which happens. Okay, when the supply happens, see, behind. Can you see that? That is the hose pipe which is connected through the central supply of trigas, and through that hose pipe the you have the supply of the trigas coming inside that through the filter. It absorbs all the VOCs. Okay, and then it is getting. Can you see that? Then it is getting purged through that solution of normal saline. Okay, and through that solution of normal saline or sterile water, whichever you may choose, it is going to supply the gas inside the chambers. The advantage with this is because the bench top has a small window. Okay, what it does is it allows beautiful concentration of the trigas along the culture plates. Definitely, it improves the blastulation rates as compared to a box type incubator. There is no doubt on that. Another flexibility is you can accommodate a lot of plates in a small volume. So let's say you can have 2 or 3 incubators kept parallel to each other, and then you can have a set of incubators which are stacked on it. This is the great advantage of using a benchtop incubator. Okay. This the second incubator which I am showing now is again from my laboratory. This is a standard box type Heracell incubator. You can see this Heracell 150 liters, keeping the temperature at 37 degrees and the CO2 at 6 percentage. Okay, and it has two functions: auto start and contracon. Okay, so contracon is something which heats up the incubator and it is used for cleaning up the incubator once in approximately a quarter. And auto start is something which we do once in 35 to 40 days in order to ensure that the incubator is cleaned up. All right. Now, this is the most standard incubator. You open the door can stay open for 30 seconds, before which it starts to blink. See, you can see the compartments here. It is divided into 3 compartments. The middle compartment is containing the culture plates of the patient. The lower compartment, as you see, has the media which is used for equilibration. And on the top compartment, there is a fan. Can you see that? This is the lower compartment using media for equilibration. And in the top compartment, there is a fan there. Okay. So this top compartment fan, we usually keep just a single culture well plate with oil inside this to absorb the VOCs which may come from the cylinder. Okay. This is obviously, buffered. So it has a solution of sterile water kept at the base, absolute base, which allows for humidification inside the incubator. And this is a very standard, cost effective incubator, predominantly if you are culturing everything till day 3 or if you have a batch IVF. Okay. And this, of course, is the most expensive incubator out of the lot. This is a time lapse. So as you can see, the time lapse is again like a benchtop incubator having singular culture plates. So this is a culture plate dish which is empty. This is the other culture plate dish. You can see the culture plate being labeled there, and you can obviously see everything onto the time lapse as I'm trying to show. It will show you some beautiful way in which the embryos are growing. So we'll just try and pick up, let's say, one of the embryos which has gone till blastocyst, which is that embryo, and then you can play how the embryo goes till blastocyst. Okay, in all of this. So when you play how the embryo goes till blastocyst, right from start to end. Let's say I want to see it, what happened from the first moment itself. Okay, then I can play something like that. And once I play something like that, I will be able to see the entire development. Okay, so when I'm able to see the entire development, what is the advantage? Simple. Okay, I am able to tell the patient everything from the 2 PN stage. You can see the PNs are getting separated, equivocal division. Once the equivocal division has happened, it is going from 2 cell to 4 cell at a particular time. Again, equal division, no fragmentation. This is one of the biggest markers of the embryo being a euploid embryo, matching the first 2 timelines. Then it is going on to the 8 cell stage, as you can see, with around 5 to 10% fragmentation, following which it will obviously develop into a morula, which it has developed, and then comes the stage of developing the cavity inside the blastocyst. Okay. Now, this is important because this allows you to give a beautiful explanation to the patient as to why embryos formed and why embryos did not form. Okay. It does not really increase your success rates. It does not make more people pregnant, but this is something which really, really enhances the way in which the patient experience of a particular IVF center is. Okay, and I think that is a very, very important thing in today's time and age, especially when we have to do so much IVF for so many couples who are desiring of self cycles. Okay, so these are the three predominant things as clinicians you need to know. Obvious questions people will ask is, I am running a new IVF center. Should I buy a box type or should I buy a benchtop? Very simple. That's the commonest question which people will ask. So remember, till you don't cross 10 cycles, and if you're doing it in a batch, then the answer is you should go for a box type a box type incubator like a Heracell. The reason is you can use the lower compartment to equilibrate, you can use the middle compartment to culture, and the top compartment is empty. So your economics of the IVF is very good. The minute you cross these 10, 12 cycles, 14 cycles, you can go for a benchtop incubator. The advantage which anybody has in a benchtop incubator is obviously you don't really have to open the lid for the next 4 to 5 days, and you can have approximately 8 patients if you are using a central culture system in approximately one incubator. So if you are having, let's say, 15 patients or 20 patients in a month, that is when you usually try to shift to a benchtop. If you are a center who is doing exclusive blastocyst, then it is recommended that you go to a benchtop as compared to a box type. If you are using predominantly day 3 embryos, as commonly happens when somebody is doing a batch IVF cycle, because on day 3, majority of them would like to transfer these embryos, then you can go for a box type to start off with. Time lapse, as I mentioned, is an incubator system which you should use only and only once you cross a certain number of cycles, because it is expensive. The maintenance of these incubators, especially time lapse, is expensive. AMC sometimes can be expensive. Okay, so that's your choosing. Second question, which everybody asks, is how do we clean? It's very simple. Okay, the box type incubator has a own system of cleaning called auto start, which I was just telling everybody about. Empty the water, put fresh water, and do auto start. Okay, and then there is a system of doing contracon. You empty, you clean, you do contracon, and then you auto start. It's a very standard thing. Nobody needs to listen to me. It is just the instruction on the machine. Okay, it really, really helps before starting your batch. So you should do it 4 days before your batch starts. Okay, the contracon or the auto start, because that much is the time which the incubator requires to equilibrate itself. The benchtop incubators are simple. You can use either hot water or sterile water or safe or whatever type of these fancy solutions which you have in order to clean it. And once you've cleaned it and you've changed the bottle, the purging time inside the bottle is just 15 to 20 minutes. After which you can start using the incubators. Okay. So cleaning a benchtop incubator is really, really easy. It doesn't require anything. Okay. Coming to the cost. The box type incubators are usually going to cost you in the range of around 7 to 8 lakh rupees. The benchtop incubators are going to vary from approximately 12, 13 lakhs to 20 lakhs based on how many plates, what all systems you are choosing. Okay. And the time lapse is going to cost you approximately 90 lakhs to 1 crore based on again what system and what configuration you are choosing. So you choose according to your requirement, according to what fits into your system the best, and you can go ahead. Again, a lot of times people would ask that, okay, I have an incubator. Should I use a single step media or a sequential media? As far as single step media and sequential media is concerned, it doesn't really depend on the incubator as such. Okay. But remember, if you're using single step media, that means you don't want to open the lid from day 0 to day 5. So the best incubator to use a single step media is obviously the time lapse. Second best is the bench type, and third best is the box type. See, box type incubator has only one problem. Let's say there are 5 patients kept in a single chamber. Even if you want to check the third patient, you are exposing all the other 4 patients to the outside air, correct? Which doesn't really happen so frequently in a benchtop, and which actually doesn't happen in a time lapse, correct? So that is the only thing which is the problem of a box type incubator, which is why I said box type incubator is great when you are doing batches. Because once you do the ICSI, Your embryologist just needs to check on day 2 straight in a box type incubator. Open the box, check all the plates, put all of them back inside again. Go back on day 3, freeze them. Finished. Right? So your opening of the chamber is just twice. That's the only thing which you need to remember as clinicians, practically. And third thing, all these guys run on medical grade cylinders. If you require 1 cylinder, you keep 2. If you require 2 cylinders, you keep 4. That's the simple logic. Never ever run out of cylinders and gas in an IVF setup, even in crisis situations. It is always better to keep extra cylinders. Beyond this, there is nothing which a clinician needs to know as far as understanding of incubators is concerned. So now you can ask questions, Shilpa madam.
Oh, I thought you will give a pause and then start again. Sorry.
No,
Okay.
no, paused.
Okay. So tell me, I mean, these are all humidified incubators, right? What is your take on
Yes,
dry incubators?
humidified is better for embryos.
But the whole Western world is moving towards dry incubators.
They
Because
are, they are. Like for example, time-lapse is almost a dry incubator, to be honest with you. There is no humidification which goes inside it. Till you can't be 100% sure of the quality of the tri-gas. Okay, some humidification is better. It really absorbs the VOCs. I can't really tell you that the medical gas, tri-gas cylinders which are available in Bombay are probably same as, let's say, Chhattisgarh. I don't think, I'm sure there must be similarities, but we don't have certified medical grade cylinders only for IVF, which is unlike how it is available for other countries, right? So till we don't have that, it's of course good to have a dry incubator. As I said, I use a dry incubator. Time-lapse is a dry incubator, correct? But I think for an Indian scenario, humidified incubators are still better.
so you say like you're using dry incubator, right? Have you seen
Mhm.
any difference between this humidified incubator to the
No,
dry incubator? Like,
the thing is, patient factor is the most important thing in formation of embryos, not the incubators which you use.
hmm, hmm, hmm. So all benchtop incubators are multi-chamber, is it? I mean, they have multiple chambers, or how does it work usually?
Usually, yes, 2, sometimes 3, sometimes even 6, based on how many number of plates they want to put inside. But
Hmm.
but it again depends, madam. It depends on what you are choosing, what type of make you are choosing inside these incubators.
So you are saying that the incubator that we choose is only dependent on the cycles that we are doing, or is there anything else apart from that, like the temperature of our place, like compared to say Ooty and compared to somewhere which is very dry. So does
Tell me
that
one thing, Shilpa madam. Does the body temperature of women vary from Dehradun to Chennai?
no?
No, it is 37. The
Wow.
incubator also has to give you 37, right? For the incubator to give you 37 without the motherboard getting damaged, you need a sine wave inverter, which is now even a requirement by the law. When they come for inspection, they want to check if your IVF systems are actually running on inverters, isn't it? Because of the uninterrupted power supply, which does not cause the circuit to trip. And when there is no tripping of circuit, the gas flows nicely. Simple. So I don't think it really matters.
So what are these holding and working incubators versus overnight incubators? I mean, I couldn't really understand much on that. Um,
Useless. Basically, just remember one thing. If in case you want to have a holding incubator, no, that is predominantly for a very short passage of time of, let's say, embryos or media, let's say for 20 minutes, something like that. Like, for example, I'll give you an example. When you want to prepare sperms, okay, for IUI, and when you want to incubate them for the swing of technique for 45 minutes, okay, that you can use as a holding incubator because it is going to become very unsterile.
mm,
Okay. The working incubator is going to be a sterile place. Okay. After ICSI is done, you have decided, labeled, named plates, everything, and you put it inside that and you don't open it for, let's say, 2 days, something like that.
mm.
Correct. But it doesn't really matter in benchtop, because in benchtop incubators, every incubator is a working incubator. It's simple.
Okay. So between the tri-gas and single gas, is everything now tri-gas or we still have?
Most of it. No, no, most of it is tri-gas now, madam. It has to become tri-gas slowly and steadily. Some of the incubators which I showed are from my laboratory. These are 7, 8 year old incubators. So that Hera cell which I have is a single gas, monogas. But as I said, now even the box type incubators are available as tri-gas.
Hmm. So is it like incubate dependent? Like you get to choose like the Hera cell with a single gas or with a tri-gas? Is it like that?
Yeah. You can choose whatever you want.
Come on, don't look so surprised. I mean, I'm asking a genuine question.
No, no, I'm also telling genuine. Just look at the catalog. It has whatever you want. It will give you. It is just
Oh,
adding 2 sensors. It is not changing anything. You need a sensor to tell you CO2 is 6%. You need a sensor to tell you oxygen is some percentage. You need a sensor to tell you nitrous is 5%. Simple.
but why do we still have both? I mean, isn't it like mostly tri-gas which needs to be there? Why do we still have is
The
it for the
older
quantity?
the the older incubators and microbiology incubators are all single gas. They don't have tri gas. Okay. They just need CO2, because quite a lot of the culture no is anaerobic culture inside that. Okay. But other our human incubators which we use can be tri gas, can be single gas. It doesn't really make a big difference unless you are aiming for exclusive blastocyst, as I said. Because the first 3 days, no, till day 3, the oxygen requirement of the embryo is not very high. After that is when the oxygen requirement shoots up, because obviously it is to go from 8 cell to 120 cells, so oxygen requirement will go up, isn't it? So that is when you need a tri gas, which has a steady oxygen supply.
So we are talking about temperature, humidity, and the concentration of the gases, isn't it?
Correct.
So all these three, I mean, humidity, of course, we spoke about it, that humidified incubators and which are
Or
moving
non-humidified. Yeah.
unhumidified or dry. And gas,
Hmm.
we spoke about either the single gas or a dry gas. So temperature anyway is standard, right? I mean, it is just 37 degrees and nothing else. So among these three, which do you think is a problem in the incubators? I mean, which is most sensitive? Is it the humidity which is going to trouble us, or is
Gas.
it the gas?
No, no, gas concentration. Because gas concentration, if your sensor is defective, gets spoiled. You know. So gas concentration is the most important, which is why, as I said, medical tri gas. Medical tri gas is going to come to you with a certificate.
Hmm.
Percentage CO2, percentage nitrous, percentage oxygen. What if that certificate is not valid or certified? No, which can create a problem in formation of embryo.
Yeah. So this the sensor that you are saying. So do you
Yeah,
recommend to add additional sensor to make sure that if the gas levels are going down, it automatically sends out an alarm, or it is inbuilt in the incubator? What does it? What do you
most
say?
of the incubators have it inbuilt.
Okay.
They'll start beeping.
Hmm, hmm, hmm.
When the purging stops, it will beep.
So, AMC, what is your take on the AMCs for these incubators? Do you have AMC for these, or only the time lapse as the AMC?
I don't have AMC, madam.
No, not you. I mean, people like normal people who want to have AMC.
You can take, but these incubators don't really get spoiled so easily. If
Mm.
they get spoiled, a lot of motherboards are available in the gray market, much cheaper than what these people sell. So it's not a big deal.
So, how many times have you repaired your own incubator? The one you have now from
Bench
7.
top, the bench top, I have repaired it only once. The box type, though, we've repaired 3, 4 times. One time the motherboard went, then the sensor went. It will happen, no, madam.
Mm. Okay, anything else you want to add on the incubators? I mean, I have run out of questions because that's where my limitation
No,
of
no.
my knowledge.
Honestly, honestly, one just needs to know this much. I really think, apart from what we discussed on the incubators, very, very important point, and one should not forget this, is how you prepare the culture plate. like adding of oil above the culture media is a very important
Yeah.
part to reduce the VOCs from going inside. Open culture is not as great. Closed culture systems are better. There is no question in that. If you do co-culture, that means if you culture your embryos together as a group, 4 or 5 embryos getting cultured together, that is a much better option compared to culturing these embryos in 20 microliter, uh, you know, 20 microliter small drops, rather than use 40 microliter and put 3 embryos, something like that. Okay. So that is something which people should understand, and that is also very, very important part when it comes to when it comes to going a good culture system in a good incubator. And I think that is something which probably we can touch up in the subsequent master classes. Yeah. So I think with that, probably we can finish and we can have rest of the
No,
questions or
one second.
oh,
So tell me, like the culture, the all this incubator, we are all dealing it with the embryos once we place it inside. So there are so many things which you do outside the incubator, right? The ICSI that you do, and so for this, is there any incubator which is available wherein you can do it even under that strict temperature control in the ICSI?
it's not possible, madam, because you will have to mount a optical microscope inside the incubator. It doesn't make sense. It is under oil overlay. Okay. So the exposure to the outside temperature and outside instability is very less for that gamete. Your gamete handling has to be good,
Mhm.
honestly. But if your gamete handling is good, then I don't think one should be worried.
Yeah. Yeah, this was very good class. Thank you very much. It really was nice. It was very
Okay,
simple
madam.
and very informative.
Thank you.
Thank you. Yeah.
I'll share the number of those gray market dealers. Somebody has asked that. It's very easy.